Assalamu alaikum wa rahmatullahi wa barakatuh. During the time of Hajj, you may encounter a patient who is infected with MERS coronavirus. The Ministry of Health has developed guidelines to efficiently identify and triage patients with symptoms that may be indicative of the virus. Visual triage should be implemented by a physician or experienced nurse to quickly identify all patients with acute respiratory illnesses. Once recognized, patients with respiratory symptoms should be placed in a separate area for assessment. This area must be separate from other patients, visitors, and unprotected hospital staff. Stations for hand washing and putting on masks must be made available at the earliest possible time after the patient arrives at the healthcare facility. Initial history taking will make known patients who are prioritized for isolation and personal protective equipment. Let's imagine that a patient, Mr. Ahmed, has arrived at East Arafat Hospital in Mecca. The patient enters the emergency department accompanied by his brother and is greeted by an emergency room nurse. The nurse then asks him, while standing 1 meter away, "What is your major complaint?" If he says that it is a simple cough and a sore throat, he is directed to the clinic where a triage for MERS coronavirus will be carried out. If his symptoms are serious, such as respiratory distress with cough, he is kept in the emergency department in the respiratory illness emergency room area. At that time, Mr. Ahmed and his brother put their masks on and are directed to wash hands thoroughly. The patient receives further assessment by a nurse wearing personal protective equipment. If Mr. Ahmed is then found to have a temperature of greater than 38 degrees Celsius, he will be admitted as a suspected MERS coronavirus case only after making sure that he fits the criteria. At this time, the physician will notify the MERS coronavirus team through the hotline 937. If the patient had been identified in the community through a primary health center, the same principle of triage would apply. Triage leads to early identification and minimal exposure for patients, families, and the healthcare team. As a physician or healthcare provider working during the Hajj season, you are the community's first line of defense and your patient's best advocate for quickly identifying, isolating, and treating people with suspected MERS coronavirus. Follow these guidelines and keep your hospital or clinic free of transmission of MERS coronavirus this Hajj season. It is important to remember that you are not alone in your decision making. There are specialized teams to help you, and it is important to keep them informed.